there's an impending crisis, the stress on the healthcare system is going to be unfathomable. And as such, telemedicine platforms that are mobilizing to do the same thing right now are going to greatly reduce the strain on that. The way that people connect to the doctors hasn't changed much in thousands of years, right? In order to connect to the doctor, you have to physically go to an office. They have to take your temperature and take your vitals and feel you and poke and prod, right? That's just how medicine happens. So that's what people are used to. So when you get sick, the first thing that you do is you look for an urgent care. You want to see the emergency room. You call your family doctor. Telemedicine gives people the opportunity to stay at home and not leave the house. And that's what's critical, because that reduces the strain, that reduces the backup in the emergency rooms, that keeps hospital beds open for people that really, really need them. A lot of the symptoms of COVID-19 can be mild and can be just kind of rode out at home. And so telemedicine gives patients the ability to not panic, not get scared, connect with a medical professional, and find out what their true next steps are. Sometimes it's filling out a form, a Department of Health form, and submitting it to the Department of Health, and then the department takes over and arranges testing for the patient, or notifies the patient of local testing sites that the patient can go to actually get tested. And then in the event that they need some emergency care, or they're in critical condition, then the health department and the medical professionals on the receiving end guide that process as to where that patient goes, how they get in. There's doctors and clinics that are out there that don't currently have a telemedicine tool. The other part of our platform is that we are deploying our software for doctors' offices. During this time period, we are deploying those services for free. So if there's a doctor or clinic that does not have a telemedicine tool, but feels that they need one in order to better serve their patients, they can use the Healy platform for free during this time.